To prescribe in MetaOrders, click on the MetaOrders icon. You will see that the background layout changes and a new form appears. This form is designed to prevent you from prescribing for the wrong patient. So look at the name of the patient, what they came in with, when they came in, and if you have selected the wrong patient, then please cancel out of the form. It is most important not to make this serious mistake. If you're happy, continue to prescribe. You will see some shortcut buttons in different colours. These colours are chosen to show green for peripheral IV, yellow for oral or gastric, brown for subcutaneous or IM, purple for central venous. The shortcut buttons are divided into various categories such as analgesics, antimicrobials, GI, and so on. We're now going to prescribe a drug using one of these shortcut buttons. Click on the Metavision infusion, and this opens a pre-populated order form. But it is your responsibility to ensure that everything on this order form, this is the prescription, is correct before you click OK. When you click OK, you will see in the background the Metavision infusion appear. If you pull the form down, you can see that the yellow bits are the current regular and PRN prescriptions, and some information about that prescription is shown. The blue at the bottom is drugs that have been prescribed but not yet administered, so pending, or they have been administered. So we're now going to prescribe a once-only drug. We're going to prescribe propofol, which we've given to this patient to induce anesthesia, for example. I'm going to change the dose to 150 milligrams, and notice it'll be prescribed for now. Click OK, and it appears in two places in front of you. The reason for this will become clear. Now normally when you prescribe, the nurses will do all the administering, and they get a reminder in this form here. But if you gave the propofol, they will not select this, and you will have to do it to document that it's been administered in Metavision. But it's very simple. Notice that the propofol has disappeared from the scheduled drugs, but is still down at the bottom. And this is a feature of once-only drugs. They only appear transiently in the yellow bits, but they stay in the blue bits at the bottom. You can see a different layout in the background by clicking that button, and you can see that the two drugs there, one is pending, the hatched bit, and one has been given, the red bit. Now if a drug is not a common drug, so it's not in the list of common buttons, you will have to open a blank parent order form and select the drug, in this case filgrastim. Now I've chosen the injection, which is fairly unusual, and this isn't particularly well pre-populated, so you have to choose the right dose, the right solution volume, and the right time that it's infused over. Again, you'll see it in the yellow background as a scheduled or regular drug, and the nurses will get a reminder. Notice that the next dose is due at 1800 hours. This is a particular problem for antibiotics, because if you select an antibiotic that is given at 8, 16 and 24, the next dose will actually be at 24 because of the time that it is. There are two ways round this. Sometimes you will be given the option that will appear in a moment, that a little alert that you have to resolve will come up, and it will invite you to select the missed dose rather than the next dose. And because it's only just past 4 o'clock, 1600 hours, that's okay. Sign now is the way to get out of that. But an alternative thing is to prescribe the next dose as 12 o'clock in the evening, 2400 hours, and then prescribe a one-off dose of coamoxiclav. So there are various ways of achieving the same result. So this is a once-only drug that will be given after 4 o'clock, but will not be repeated because the regular one due at midnight will take over. I'm now going to show you another form of alert. So let's choose magnesium, 20 millimoles, to be given through a CVC, but we'll try and give 30 millimoles instead, and we get another alert which we have to resolve. When you click on the resolve, it tells you that you've exceeded the dose and gives you the opportunity to change it back to 20 millimoles. But the form doesn't look as if you've done anything, but if you click sign now, then everything is hunky-dory. Before we leave this form, we're going to prescribe some fluids. You can either prescribe them as one-off or PRN, or as a continuous one, which we're going to do. We're going to choose dextrosaline, and this prescription will just continue for the next 10 days or until you stop the prescription. Its starting date is now. In theory, you could put a number of bags that you want to give, or the dose and time you want it to stop, but there is a bug in Metavision that means that you must not use this facility. So for any continuous drugs, please do not put a time limit on. You can add potassium if you like. So we exit the form at this point, and we can see all the regular scheduled drugs and infusions that are prescribed in the yellow and white section. And if you click this menu here, you get a number of options. You can mark a drug as an error, but only use that if the drug hasn't been administered. If it's been administered and you want to mark it as an error, then choose discontinue. If you want a drug not to be given until further notice, you can click hold. And if we look at the drug reminder now, you'll see that filgrastim does not appear for the nurses to administer. If we then click release and look again, hey presto, it's back. But if you want to just omit one dose rather than all the subsequent doses, then that's slightly harder, but it only affects one dose. You have to select the dose in question, and you choose skip. You then offered a reason which we haven't customized as yet, but you can write something in the comments. Wait until tomorrow. That then puts a red cross on that particular dose, but only that dose will be skipped by the nurses. So subsequent doses, i.e. tomorrow's dose and thereafter, will be available to be administered. If you look at the drugs tab, it looks very much like it used to do. For anybody who's used to standard orders. And if we play nurse and administer all these drugs, this is what you'd see if the nurse had been administering them as you were prescribing them. And this is what the other view looks like. Instead of being open symbols, they're now filled symbols and filled lines.